Good morning. Okay, this is a part two to the video I posted before. In the video before, I had obtained consent, did hand hygiene on myself. I cleaned the site thoroughly. I also provided a lot of education to the patient about long-term complications that can come with suturing or any open area to their body. I have numbed the site. As I explained in the first video, your instruments are going to come in a closed sterile packaging. This is a sterile sheet, and you just have clean gloves here. Due to the purpose of demonstration, I'm not going to put these on, but obviously very important for the protection of yourself and to the patient. I'm just going to grab the suture. And you'll see that the laceration is right there. You never want to touch the needle. Beautiful. And you want to make sure that when you pull it all the way through, that after you're securing your knots, that the skin is going to lay flat for optimal healing. One, two. Okay. Nice and taut. Gonna go over one and down. I'm gonna go under. Down. One more time. Excellent. You want to just, keep an eye on the needle. You don't have to be touching it, just when you're wrapping it around your instrument, that you know where it is at all times. So that is one suture. I'm just going to cut the excess. Okay, you can lay it flat. Okay, again. Very careful when you're pulling it through. One, two. going to go under 1. Going to go over. One more. I'll go over again on that one. Beautiful. You want to keep checking in with your patients, seeing if how they're tolerating this. The lidocaine should have numbed the site quite well, but you want to make sure that they're comfortable because you could inject more. You'll see right now we already had 2, and now we're going to do 1 more. Again, don't touch the needle. Okay, last one. Be careful pulling it all the way through. Two times. Okay. We're going under. We're going over. Now we're going to go over again. Perfect. And you want to leave a little bit, but not too much where it's an irritant to the patient. You'll see that my sutures are evenly distributed along the laceration, and then the skin is flat and taut. Okay. So now is an opportunity for you to educate your patient about instructions going forward. For the first 24 hours, I'm going to send the patient home with a dressing. I just want them to keep that dressing on, keep it closed. And then at 24 hours, they can take the bandage off, and I want them to gently wash around the site 1 to 2 times daily. They can wash with cool water and soap. I don't want them to scrub directly on the sutures, as this could cause them to come out prematurely. They can dab the site with a clean paper towel each time. Avoid using towels directly on, as that also could be abrasive to the suture. Some over-the-counter bacitracin or Neosporin can be applied after your wash twice daily, and you can then keep it open to air. In my video before, I had also talked about signs of infection, so if you see any pus or erythema pain. Those would be signs of an infection. Monitoring for fevers, chills, body aches. So please, keep the clinic in mind if you do have any of those, and we can help advise you. I would like to see you back in 7 days for an in-person visit where I can cut the sutures for you. All right, that concludes my suture activity.